Warning: please do not use or derive concepts from this video to try answering questions and incorporating it into the steps of a diagnostic approach to a patient. This video is presented by Animoma. Today I'll be talking about Itachi Uchiha and the Sharingan. So Itachi is the perfect specimen because he is the only person that we have data on that suffers from the long-term health effects of the Sharingan. It is theorized that he has microscopic polyangiitis due to his hematemesis and visual acuity issues, but this is not possible due to the lack of biopsy to confirm this diagnosis. And usually when you suspect hematemesis in a young individual, you perform an endoscopy to rule out upper GI bleeding. I think he has systemic glaucoma. What I mean by this is, I'll explain in a bit. So there's two types of glaucoma. There's open angle where fluid builds up in the anterior chamber, and then there's closed angle glaucoma where fluid accumulates in the anterior chamber and then seeps into the posterior chamber, causing increased intraocular pressure and compressing the lens. And this ocular pressure is also compressing the optic nerve, which causes peripheral vision to be compromised. And usually closed angle glaucoma is much worse than open angle glaucoma, but in an Uchiha, an open angle glaucoma might just be as worse because for the Uchiha, blood will start to build up in the anterior chamber of the eye, and it is assumed that the Uchiha have larger pores, and the fluid developed a mechanism in which it can be extravasated from the trabecular meshwork at a much quicker pace. So usually vitreous hemorrhage in the eye causes fluid to accumulate outside of the retina and causes retinal detachment. But this can also occur with open angle glaucoma in a Uchiha because the fluid will go through the trabecular meshwork and cause the retina to separate. And a retinal detachment usually presents with sudden onset of flashing lights and blurred visions. Patients typically describe it as a curtain down coming over their eyes, and ophthalmoscopy will show a gray elevated retina. And since the fluid will also go through the trabecular meshwork to the rest of the body, just so the fluid has somewhere to go, so this can exacerbate hypertension. And so there's a chance, since there's increased intraocular pressure, there'll be increased intracranial pressure. And Cushing triad usually consists of increased hypertension with bradycardia and bradyapnea. And then the formula for cerebral perfusion pressure is equal to mean arterial pressure minus intracranial pressure. So since there's increased intracranial pressure, the body will try compensating by increasing the mean arterial pressure. But this also exacerbates the hypertension with all the fluid leaving the eye and towards the rest of the body. And that can also explain the hematemesis, because the excessive hypertension can cause blood vessels to burst and cause hematemesis in Itachi. So usually to treat elevated intracranial pressure, you tell the patient to elevate their head and increase their ventilation initially. And they used to think mannitol was a good idea, but it's not a good idea because it may decrease intracranial pressure, but it also decreases mean arterial pressure, which would decrease cerebral perfusion pressure. And if this method doesn't work, you can go to a more extreme case and just perform a lumbar puncture to drain the fluid, or you can create a peritoneal ventricular shunt. So as we know, the Sharingan is caused by a heightened of emotions, and this can activate the sympathetic nervous system, and this can cause extreme vasoconstriction. And let's say that in battle, an Uchiha suffers a devastating blow and is bleeding out. They will have hypovolemic shock in this scenario. But now the excessive vasoconstriction can cause blood vessels to burst and exacerbate the hypovolemic shock to even a worser degree. And the Uchiha, they have an increased chance of macular degeneration. This is because Macular degeneration usually occurs to drusen deposits depositing between the Broussard membrane and the retinal pigment epithelial layer. This is caused by an acute accumulation of white/yellow extracellular material, and they have an increased chance of it depositing because of the increased amount of muscles in the eyes, so there's more extracellular fluid, and because the fluid is moving at a faster rate. So now I'm going to talk a little bit about the anatomy of the eye of the Uchiha. So let's say that this is the coronal view. My theory is like they kind of have like flaps right here, and those flaps can fan out like this. And these are clear, and so there'll be multiple versions of these, and they can overlap one another just so the eye can focus on a particular object. These can also move as well, and since there's more moving parts, so there's a higher chance of these parts being damaged. And another thing is, since the eye has to rotate much further, and they would need stronger muscles, as well as this would cause the muscles to spiral up, and they would have to be longer than the average eye. And if these muscles get damaged, they may be able to repair a few times, but if it's overused, these muscles can be damaged and may need replacement. And since intraocular pressure can increase intracerebral pressure, which can increases the risk of Uchiha women on OCPs taking vitamin A of reproductive age. And through evolutionary mechanisms, the Uchiha probably have much stronger eye muscles than the normal human being. Okay, so since the Uchiha are constantly having to switch between the sympathetic and parasympathetic nervous system when having to look really far away or really close by, they can have a switch between the parasympathetic and sympathetic nervous system, which can eventually develop vasospasms and cause the blood vessel to rupture. Even though the eye is avascular, it still somehow heals, but the Uchiha have developed a mechanism in which blood can be transported to the eye, and this can help with O2 exchange and help with the healing process. They probably have increased angiogenesis around the eye to help with repair as well. And immune transplants, the eye is immune and doesn't have an immune response when doing a transplant. So that's a good positive in helping the Uchiha with damaged eyes. A lot of times with the Uchiha, you'll see ciliary flush. This is probably due to the strain on the eye, and opponents usually know that the Uchiha are known for their Sharingan, so they'll constantly try attacking their eyes, and the first sign you'll see is a teardrop pupil. And so the treatment plan is, since eye transplants are more common, you may want to watch out for Creutzfeldt-Jakob's disease because this is prevalent in corneal transplant. And surgery is probably going to be more common for the eye as well, and replacing the excessive muscles that they have will probably need to be removed or replaced. These patients should also be taking calcium channel blockers to prevent the vasospasms and to decrease the hypertension throughout the body. You may want to put an Uchiha on glaucoma drugs, for both open angle and closed angle. Latanoprost is now the main drug used for closed angle glaucoma, as opposed to the past it was timolol. And an Uchiha should also be undergoing like weekly or monthly ocular massage with high flow of O2 therapy. And it is advised that if you are pregnant, that you don't use the Sharingan too often, as well as if you have another neurologic state or any other disease process that increases the sympathetic nervous system activity, such as maybe hyperthyroidism or pheochromocytoma. And another reason to not use the Sharingans if you are in a disease process that causes hypertension, such as atherosclerosis or obesity or coronary artery disease. All right, thank you for watching.